For those of you who don't know that much yet about the Centre for Social Ethics and Policy, I wanted to just update you on a few things that have been happening in the last 12 months. We've had quite a busy year. We've done various things with our teaching. We've introduced some exciting new courses. We've had all kinds of success with our research, and we've been engaging with professionals and user communities. Just to tell you a little bit about the research that's been going on, Professor Brazier has been working with Sarah Devaney and with Hannah Quirk on developing some guidelines arising out of a research project that she did looking at the role of the criminal law in resolving ethical conflicts in the healthcare context. So those guidelines will hopefully be coming out very soon. Our very own Catherine Stanton has also been working very hard. She's been looking at a project on how the law responds to contagious diseases, and an edited collection is coming out of that. Catherine has also been very busy with Alex Mullock and Sarah Devaney, to name but two others, who have been editing a collection in honour of the contribution that Professor Brazier's work has made to the field of medical law, and that's out later this year, so watch this space for a launch event to celebrate that achievement. Other than our research outputs, we've also been working with healthcare professionals and also with patient groups, as we tend to do through our continuing professional development work and also our advice and training. Neil Allen, who can't be here today, has had quite significant impact for what he describes as all the wrong reasons when he represented a local authority before the UK Supreme Court in a famous and also infamous case known as Cheshire West. For any of you here who are familiar with the deprivation of liberty safeguards, this will send a shiver down your spine. In addition to that, Neil has also been carrying on his sterling training for health and social care professionals who are carrying out their responsibilities under the Mental Health Act. Added to that, I suppose I ought to mention that I've also continued to work in the field of adult safeguarding and have led on a couple of serious case reviews this year, both of which will be made public in summary form later this year. In addition to that, we've had some great teaching innovations. We've launched 2 new courses for our distance learning and our campus-based courses. We have a course on the theme of international law and ethics, where we've explored how the conventional way of looking at ethical conflict really needs some further reflection before we try to apply that to the global stage. So we've been examining issues of regulating biotechnology, managing global public health issues such as epidemics and famine within an ethico-legal framework. Those courses have been very well received. We're rolling them out on our distance learning and our campus-based courses, and we look forward to seeing those develop in future years. We've also this year started to roll out lots of new CPD courses. We are launching one very soon on genomics. We are also producing further ones on mental health law and also on ethics, genetics, and also research ethics. So if you are healthcare professionals looking to keep up to date, do bear that in mind.